In this video, as a practicing doctor, I'll help you understand atopic dermatitis. Later, I'll recommend top moisturizers and explain selecting and using steroids. And in the first half, I'll talk about why atopic dermatitis occurs in the first place, its surprising origin, and some things other than medication that might actually be effective. I'll discuss how to manage dust mites and allergies, the differences between ointments, creams, and lotions, and if steroids actually darken skin. If you're interested, this video is a must-watch. Good morning, I'm Dr. Mandarin. Atopic dermatitis is very itchy, your skin gets rough, and you want relief. Even with prescribed steroids, it doesn't improve. First of all, a lot of people are worried about the safety of steroids and whether their skin will get darker. Minister Kono's tweet about this became popular. I have atopic dermatitis. Got a problem with that? I think a lot of people felt really encouraged by that. Minister Kono is pretty cool, isn't he? The reason this tweet went so viral is because there are so many people struggling with prejudice against atopic dermatitis. Do you all understand how tough atopic dermatitis is? Everyone, please take a look at this image. This is caused by atopic dermatitis. It shows how itching and skin lesions from atopic dermatitis can lower your quality of life, or QOL. 36% of people actually feel that it interferes with their daily lives. About 60% report less sexual desire. Half struggle at work. 40% say it affects school or career choices. Their daily fatigue is 3 times higher. There are 2.66 times more people who actually feel sleepy during the day. Do you understand how tough this is? I think it's hard to imagine. Some people might think it's just atopic dermatitis, right? But for people with atopic dermatitis, there are many who feel inconvenienced by things like drowsiness and career choices. Some people might think, if only I didn't have atopic dermatitis, maybe I could have studied more. Maybe I could have gotten a better job. Maybe I could have gotten that dream job. I think there are at least some people who feel that way. And actually, about 10% of people have atopic dermatitis. And what's even more surprising is that 90% of people with atopic dermatitis aren't applying ointment correctly or are using moisturizers the wrong way. This happened when I was seeing patients with atopic dermatitis in my outpatient clinic. Their condition wasn't improving, so I had them come in every week. I asked, "You're probably running out of medicine soon, so should I prescribe more?" I still haven't forgotten that moment. The patient replied, "No, I still have plenty of medicine left," and showed me a bunch of medicine from their bag. I was surprised. It's like a field trip isn't over until you get home. I realized then that prescribing medicine isn't complete until you teach the patient how to use it. Surprisingly, doctors at hospitals often have too many patients and can't give proper instructions. So in this video, let's make sure to learn the correct way to apply ointment, how to use it, and for how long. Let's remember this well. This video offers a doctor's insights on atopic dermatitis. In the second half, I'll recommend top moisturizers and explain steroid selection and application. And in the first half, I'll talk about why atopic dermatitis happens in the first place, its surprising etymology, and also about things other than medicine that might actually be effective, like measures against mites and allergies, and ointments. This video covers the differences between ointments, creams, and lotions, and if steroids actually darken your skin. If you're interested, it's worth watching. By the time you finish watching this video, I think you'll have knowledge about atopic dermatitis on par with a doctor. I work as a general practitioner at a community hospital. I share useful health information for the general public that you can use starting tomorrow, so please make sure to subscribe to my channel. And if you find this video helpful, I would really appreciate it if you could share it with people struggling with atopic dermatitis or with medical professionals around you. Alright, let's get started. Chapter 1 is about the itch-scratch cycle. Are you familiar with the atopic cycle? Haven't you been told not to scratch your atopic skin? But that's impossible. It's like being told not to eat when you're hungry. I have sensitive atopic skin too, so I scratch when it itches, sometimes even in my sleep, and my skin gets worse. During dry season, scratching makes eczema and inflammation worse, which only increases the itch. That's the vicious cycle known as the itch-scratch cycle. If I show it in a diagram, it looks like this. The atopic cycle starts with itchiness, right? Because it's itchy, you scratch it. When you scratch, the skin gets damaged. And because of that, in order to repair it, and because of the damage caused, inflammation occurs. When inflammation happens, various substances in the body like cytokines, interleukins, and histamines become active, which makes it even itchier, so you scratch again and damage the skin further. This is the vicious cycle called the itch-scratch cycle. People often say, don't scratch here, stop scratching. If you don't scratch, you won't damage your skin, but that's just impossible. So where should we focus our approach? It's actually simple. It's here. Preventing this part is what's important. Suppressing inflammation. In the past, people used to say, let's make sure children don't scratch. There was a time when this approach was popular even in medicine, but now that's been overturned. People have realized it's just not possible, and that's understandable. For junior high and high school students, or those taking entrance exams, stress causes them to scratch their skin. This stress worsens itching due to inflammation, so trying to suppress it isn't realistic. Here's something interesting. You've probably been prescribed anti-itch medicine before, which actually targets the itch. Anti-itch medicine suppresses substances produced during inflammation, but only addresses part of the problem, making it a supplementary treatment. Controlling inflammation itself is most important. What's important for controlling this inflammation is steroid ointment. This is the most important point, so please make sure to remember it. Now, let's move on to the next section. First, let's talk about the origin of the word Atopic. Do you all know this? If you already know, you might not even need to watch this video. That's pretty impressive, isn't it? But if you didn't know, please watch this video until the end. The origin of the word Atopic actually means one direction. One direction, in other words, like an arrow. That's what Atopic means. So what does this mean? It refers to things like food, pollen, dust mites, or dust. People with Atopic tend to react allergically to all kinds of things in that one directional way. That's where the word comes from. That's why many people with atopic dermatitis also get hay fever. In spring, they have runny noses and watery eyes. Some also get asthma, with wheezing and trouble breathing. That's because people with Atopic are allergic to all sorts of things, so they also have allergic reactions in their eyes, nose, and airways. So why does the skin also develop allergies? We have a general understanding now, and it's said that people who develop atopic dermatitis have a weakened skin barrier function. Simply put, our skin has a 3-layer structure with the epidermis on top. Beneath are the dermis and subcutaneous tissue, each with a specific role. The subcutaneous tissue has blood vessels and fat, acting as a soft cushion, why bumps rarely hurt. The dermis holds blood vessels and gives skin flexibility. The epidermis is actually the most important because it's the layer that comes into contact with the environment. On top of the epidermis, there's the stratum corneum, which is a rough, flaky layer. These are dead cells. Dead skin cells cover our skin surface. So when you rub your body and see dirt, it's actually dead cells. That's the stratum corneum. In atopic dermatitis, the connections between those cells become weaker. We know this. Normally, this outer layer acts as a barrier for us, but when the barrier doesn't work well, things like mites, pollen, and dust can get through. Those things can enter the body and trigger an allergic reaction. This is a simple explanation of atopic dermatitis. So when inflammation occurs in the skin, it becomes itchy. Because it gets itchy, the barrier breaks down even more. When the barrier breaks down, things like mites, dust, and various allergens cause more inflammation. That's why it gets itchy. That's the cycle. There is a study that compared people with atopic dermatitis and those without, measuring the proportion of bacteria on their skin. What was found is that people with atopic dermatitis have a higher proportion of a bacterium called Staphylococcus aureus living on their skin. This is because the skin barrier is broken and it's easier for bacteria to enter. So people with atopic dermatitis are actually more likely to get skin diseases like impetigo, which causes redness, or fungal infections. It's been found that they have a higher risk of getting these kinds of infections. Now you understand the origin of the word atopy, right? And I think you also understand why atopy causes itching. People with Atopic tend to be allergic to many different things, and because their skin barrier is weakened, various allergies occur, leading to inflammation and itching. This is how Atopic works. Simply put, people with atopic dermatitis have a constitution that is much more delicate and sensitive than others, so what should you do about it? If you already understand the introduction and the lecture and just want the countermeasures, leave it to me. And first, you want to know ways to avoid going to the hospital. Going to the hospital is a hassle, and since you're busy with school or work, you're wondering if there's anything you can do at home for now. There is. But before that, let me share an important way of thinking. Atopic dermatitis is a chronic disease. Please understand that it will repeatedly get better and worse. Be patient with your own constitution, understand your body's tendencies, and aim to reduce the times when things get worse as much as possible. And even when it does get worse, try not to let it get too bad. And one more thing, atopic dermatitis will eventually heal. Few people struggle with atopic dermatitis their entire lives, even into their 80s or 90s, so avoid being too pessimistic or overly optimistic. I think it's important not to assume that you'll absolutely be fine and to not let your guard down, but instead to be prepared to live with your body and take care of it. The person who understands your body the best isn't a doctor or anyone else, it's you. First, let's focus on reducing how often things worsen and extending the time between flare-ups. While some YouTube videos claim a simple cure for Atopic, that's likely untrue. Let's ensure we have accurate knowledge and take proper steps. Some of you watching may be struggling with your child's Atopic. You, as the parent, are the one who understands your child best, so I'll also talk about how to care for your child. Please listen until the end. Now, I'll introduce 2 measures you can take without going to the hospital. The first of these is cooling the affected area. Some of you might think, you don't understand, just cooling it won't help with this kind of pain. Please hear me out, just try it once, even if you think it won't work. The reason why cooling is good is because it raises our body's pain threshold. By cooling, you can increase the threshold at which your body starts to feel itchy. Cooling raises the pain and itch threshold, temporarily easing itchiness. That's why I suggest it as a quick first aid option, even with items from a convenience store. Get a cold drink from a vending machine and use it to cool the area. You'll be surprised how much the urge to scratch decreases, so take care of yourself this way for now. Wash your skin thoroughly, then apply a moisturizer or something similar to reset the area. By doing this, you can manage to endure the itchiness. On the other hand, something to be careful about is warming up the area. So if you love taking hot baths, you need to be a bit cautious. Taking a hot bath actually lowers your itch threshold, making you want to scratch even more, and your skin gets softer and more prone to scratching. Later on, you'll end up feeling unbearably itchy in the middle of the night, so try to keep your bath water a little lukewarm if possible. And when you wash your body, don't scrub it hard. Use a gentle nylon towel and wash softly. Also, instead of rubbing your body dry, gently pat it with a towel. These kinds of things are important. They're things you can do even without going to the hospital. Second measure, addressing mites. Some of you may not have known about them, and if you did, that's impressive. It shows you've studied. I only learned about mites after becoming a doctor. Some people with atopic dermatitis have a mite allergy, and it's not just the mites themselves. You can also develop an allergy from the remains of dead mites, so please be careful. Mites are all around us in places we can't see with our eyes. They prefer environments with high humidity, and because these mites are so small, when the skin barrier is broken, when they come into contact with people who have atopic dermatitis, they can easily invade and trigger an allergic reaction. But here's something to keep in mind. Not everyone with atopic dermatitis has a mite allergy, so whether countermeasures are effective depends on the individual. Still, if you try Mite prevention and it helps, that's great, right? So I think it's something everyone should try. There aren't really any side effects or adverse reactions, since it's not a medication or anything like that. It's just regular mite prevention, so please give it a try. And taking measures against mites is actually quite simple. Anti-mite sheets make it harder for mites to stick, so you could try changing your bedroom sheets, for example. There are products for humidity control and vacuum cleaners for mites, so try washing or sun drying your bedding first. Start with these steps. Also, dust and pollen themselves can make atopic dermatitis worse, so cleaning your air conditioner and removing dust from your room after a long time can actually help with skincare as well. Now, let's move on to the final section. I will finally talk about how to use steroids and moisturizers. Steroid medications are extremely effective when used safely. I actually use them myself. I have also prescribed them to many patients, and I have seen them recover. The most important thing in treating atopic dermatitis, as I mentioned earlier, is to suppress the inflammation in the itch scratch cycle. If you can just control the inflammation, the itching will stop, and that will break the cycle. That's where the itch scratch cycle breaks. Steroids help suppress inflammation, but there are some precautions with them. Steroids are like a trump card, so remember this. Knowing when to use them is important. But doctor, I once heard on TV that steroids are dangerous and best avoided. They used to say that, but what do you think? That TV program actually became a problem, troubling many dermatologists at the time. If it were really that harmful, I wouldn't be using it, right? The fact that I use it should show you that I don't think it's that dangerous. But even so, people still say steroids are scary, so they don't want to use them on children. So for those wondering what to do, it's really tough, but basically, by applying moisturizer dozens of times a day, you can prevent your skin from getting damaged in the first place. Measures like that help, but you can't realistically apply moisturizer dozens of times a day. That's why steroids are such an effective alternative. So how do you use steroids? I'll explain 3 important points. 3 tips for using steroids. The first is the amount of steroid. Many people get the amount wrong. As I said before, even after prescribing multiple tubes, there's still plenty left. That's typical in Japan. Some use steroids sparingly, but you should apply plenty. While the stickiness can be unpleasant, using steroids for the shortest time possible helps minimize side effects, so it's important they're effective. If you don't apply a sufficient amount, it won't be effective. On the contrary, it's said that using a small amount over a long period actually increases the risk of side effects. And as a well-known guideline for the amount to use, there's something called the fingertip unit, or FTU. The fingertip unit means the amount of ointment that fits on the first joint of your index finger. This length is considered 1 unit, and the amount you can apply with this length covers the area of both palms. For example, if you're applying it to both cheeks, that's about the area of 2 palms. Use ointment equal to the amount that fits on your finger's first joint, but remember a few key points. Some people on other YouTube videos have gotten this 1 fingertip unit wrong. For example, this is an ointment called locoid ointment, but this ointment is 5 grams ointments that are 5 grams or 10 grams have a narrow tube, so 1 fingertip unit is actually 2 applications with these. For 25 gram or 50 gram ointments, 1 fingertip unit is just 1 application, so please be careful about that. So, for example, if you try it, the 5 gram locoid is small, so here's how much 1 fingertip unit would be. This is one application and then one more time. This makes up one fingertip unit. This amount is enough to cover the area of both palms. Since it's for both palms, if you're applying it to both cheeks, spreading out this amount will give you the proper dosage. It might feel a bit greasy, but when you apply it, it's for treatment, so it's important to use about this much. One thing to keep in mind is that one fingertip unit is 0.5 grams. This tube is 5 grams, right? If you use it 10 times, you'll finish the whole tube. For example, if you have atopic eczema on your torso, you might go 1, 2, 3, 4, maybe 5 fingertip units. If you have just one 5-gram tube, it could be used up in just one day. This is the correct amount to use. When patients visit the clinic, you can check if they're applying it properly by seeing how much ointment they've used. So, as I mentioned at the beginning, when I prescribe steroids, I basically ask patients to bring in whatever they have left, check it, and explain how to apply it. I share medical information like this that you don't usually hear about, so please make sure to subscribe to the channel so you don't miss anything. The second of the 3 key points for using steroids is how to apply them. Application method is extremely important. I haven't seen many videos on this. How do you apply ointment? This is the one I used earlier. If you spread it out on both palms and just rub it on like this, your palms will get all greasy, right? Plus, you end up applying it to your palms, and if you keep spreading it on your palms every time, there's actually a chance you could get side effects on your palms. So there's a trick to how you should apply it. For example, let's say you have your arm here and you get a rough red rash here. Let's say this is atopic dermatitis. Since it's itchy here, let's apply steroid ointment to this area. If you just spread it all over your hand and rub it in like this, it doesn't really make sense because most of it ends up on your hand instead of where you need it. As I mentioned, you use a fingertip unit of ointment on your palm, then place it in 4 spots around the affected area. 1, 2, 3, 4 spots. Dab it on like this, and finally put a dab in the center as well. Now you've applied all of it. After applying, use your hand to spread it out over the area, like this. Gently spread it little by little. By doing this, you can apply it evenly to the skin. And an important point is that atopic dermatitis doesn't just occur in the red areas. The red area will gradually spread, so it's important to apply it around the edges as well. So dab it around the surrounding area too. Apply it to 4 spots, then finally place some in the center and spread it out. This is important. It's kind of like the shape of a baseball diamond. First base, second base, third base, home plate, and the pitcher's mound. Place the cream at these points and spread it out. Please remember this. It's also important to clearly explain this method of application. 3 tips for using steroids. The third tip is how long to use the steroid, which varies based on your doctor's judgment, so there's no set duration for all. I'll give you a general guideline. The standard is about 2 weeks. For about 2 weeks, it's common to apply it every day. For the first 5 days, apply it about twice a day, and then once a day for the rest of the 2 weeks. In this way, for a short period, as I just mentioned, you'll apply the correct amount in the correct way, and we'll evaluate the results. For those who say that steroids have never worked for them before, were you really applying them properly? Were you using the right amount? That's what's important. Some people with atopic dermatitis feel hopeless, believing nothing, not even steroids, can help their skin. I think there are a lot of people like that, but please just give it a try once, even if you feel skeptical. Basically, you should follow the instructions of your doctor at the hospital, but the points I just mentioned are common, so please pay attention to these points and apply it carefully. If it doesn't improve, there are alternatives, but most people respond to steroids. This helps you see that atopic dermatitis is treatable, motivating you to care for your skin daily. That's why I explained how to use it. So basically, I have patients come back after 1 week and then again after 2 weeks to make sure they are actually getting better. If they're not getting better, in cases where they're not getting better, I check how they're applying the medication and how much they're using, and sometimes I even have them apply it right there in the examination room. I don't really have atopic dermatitis. It's probably more like dry skin dermatitis that turns into eczema. And actually, steroids work for eczema too, so when my skin gets itchy and red, I apply plenty of steroid cream during that period. Now my skin has healed so well, there are barely any signs of eczema left. Remember, using plenty of steroid cream briefly isn't very harmful. Let's review. With steroids, focus on the amount, application method, and duration. Do you recall how much area a fingertip unit covers and the correct way to apply it? You shouldn't spread it all over the palm of your hand, and make sure to stick to the prescribed duration for applying it. Let's apply it exactly as the doctor instructs. Alright, we're getting into the second half now. If you've watched this far, you're really amazing. I think you've become quite knowledgeable about atopic dermatitis. If this helped you, please share the video link online with friends who are struggling. I took the chance to promote it a bit. Next are some steroid precautions. Steroids may weaken your immune system or bones. Haven't you heard that they're dangerous? I still can't forget what a mother of a child with atopic dermatitis said to me at my clinic. It was when I prescribed steroids to a child in kindergarten with atopic dermatitis. She said, "Doctor, if someone says steroids are dangerous, I definitely don't want to use it on my child. Parents value their child more than themselves, so it's natural to feel this way after hearing risks." Since the media has created programs that scare people about steroids, prejudice against them remains strong. In fact, with long-term use, there are side effects, especially if you apply it to the face or neck for a long time. Since the skin is thin and absorbs more, the skin can become red or the capillaries can become more visible. These things can happen. However, these are just side effects from long-term use. Your skin won't turn dark because of it. If your skin does become darker, that's actually a result of inflammation. With atopic dermatitis, if you scratch and damage your skin, it causes inflammation. That inflammation is like a burn, and as a result, your skin can gradually become darker and rougher due to the ongoing inflammation. Steroids suppress this, so you can think of them as preventing your skin from darkening. Having accurate knowledge is important. The media has a lot of influence, but it can sometimes be irresponsible. The reason I share information as a doctor is because I want to provide accurate information. If you agree with me, please give this video a thumbs up. Steroid side effects can definitely include things like redness, increased acne, and the appearance of visible capillaries. Because of side effects, avoid long-term use and follow your doctor or pharmacist's instructions closely. Now, regarding atopic dermatitis, your condition is currently stable. I want to discuss what to do in times like this. Some people feel pessimistic, believing their skin will just worsen again. Is there a way to prevent that? You might think once your skin gets better with steroids, you shouldn't use them anymore, right? So what should you do? For those of you thinking that, I have good news. There's something called proactive therapy. You might remember something called proactive as a facial cleanser, but that's not what I'm talking about. Proactive means pro as in before or in advance. Active refers to activity, so proactive therapy means a treatment you do before atopic dermatitis flares up. It's for people whose atopic dermatitis keeps getting worse and better repeatedly and is hard to control. So how do you use it? Simply put, it's the intensive 2-day method, not 2 days off per week. You treat intensively for 2 days, then rest for 5. This proactive therapy suits busy people with work or school. On weekends, even if your skin isn't itchy, you apply steroid ointment to the areas where symptoms tend to appear. That's proactive therapy. And on busy weekdays, you don't apply it. There's a famous study showing that doing this can prevent atopic dermatitis from getting worse. And there's more good news. For those still struggling to improve, there's an ointment called tacrolimus. If hearing the name makes you nervous, don't dismiss it. I've worked hard to explain everything, so don't worry. I won't start promoting products. I put a lot of effort into this video. Tacrolimus ointment is very effective. One thing to note is that this is something you use when your atopic dermatitis is getting better. When it's bad, you should still use steroids. Compared to steroids, tacrolimus has fewer side effects and is a safer medicine to use. Steroid side effects are more common on thin skin, so tacrolimus ointment is better for those areas. Many women are especially concerned about how they look. I think many people are concerned about their appearance, so there are probably people who don't want to apply steroid ointment to their face. This ointment is recommended for those people as well. However, there is one thing you need to be careful about. Applying this tacrolimus ointment may cause stinging or burning, especially if you have atopic dermatitis and your skin is red and irritated from scratching. Applying tacrolimus ointment to that skin will be painful and may distract you from work. Wait until your skin improves a bit. Please consider proactive therapy or tacrolimus ointment to maintain remission and keep your skin healthy. You shouldn't use this on your own judgment, so make sure to always follow your doctor's instructions. Alright, now there's one last thing I really want to tell you. I'm the type who saves the best side dish for last. It's about my recommended moisturizer. For those of you thinking, just tell me already, thanks for waiting. Let me introduce the super important way to use moisturizers. Everyone, moisturizers are not humidifiers. Do you understand what I mean? I'm sure some of you do. In Japanese, the word moisturizer literally means to maintain moisture, right? But a humidifier is something that adds moisture. That's why humidifiers use things like steam. But moisturizers only maintain the existing moisture. In other words, if there's no moisture to begin with, they can't maintain it. This is a big misunderstanding that many people have. Moisturizers don't actually add moisture, so just applying a lot of moisturizer isn't enough. There's no point in putting moisturizer on skin that isn't already hydrated. That's why, as many people know, the best time to apply moisturizer is right after you get out of the bath or shower. When your skin is still moist, that's when you seal in the moisture with a moisturizer. So you need to add moisture first, then use a moisturizer to keep it in. Do you understand? You need to add moisture first, then seal it in with a moisturizer. So make sure to use moisturizer on skin that has already been hydrated. That's what moisturizers are for. Keep your moisturizer in the bathroom to apply right after bathing. My sensitive, dry skin needs extra care, so after drying off, I use a toner on my body, then moisturizer. You really need to go that far. First, add moisture, then lock it in with a moisturizer. These two steps go together, so remember them. Applying moisturizer is the recommended maintenance therapy for keeping atopic dermatitis controlled when your skin is doing well. It's listed in the guidelines, so be thorough, but there's a big problem here, everyone. Ever get moisturizer from the hospital? The amount they give seems pretty small, right? Things like Vaseline, B-Soft and Cream, or Heparinoid products. That's right, the moisturizer you get from the hospital is usually in small amounts. That's not good, so people end up using it sparingly and not applying enough. So just go ahead and buy over-the-counter moisturizers. Since you'll have plenty of opportunities to use moisturizer, keep it in various places around your room. It's better to keep some in your bag, too. I keep some in the living room, the bedroom, the bathroom, and even in my backpack. So keep moisturizers in various places so you can apply them anytime. That's important, so I think it's fine to just buy them yourself. So now let's look at moisturizers sold on Amazon. I'll introduce 2 recommended moisturizers that are affordable and come in generous sizes. Both are sold on Amazon and recommended by a practicing doctor. The first is Cetaphil, which many people may not have heard of. This is an overseas product. Because it's from overseas, you get a generous amount, and since this is a cream, you can apply it without it feeling too sticky. It contains over 500 milliliters, so you get a lot, and if you buy it once, it will last about half a year, so I highly recommend it. By the way, I'm not getting any money from Cetaphil for this, and since it's a cream type, it's not too sticky, which is good, but it's also not very moisturizing. If that's a concern, the next product I'll introduce, available on Amazon, is recommended for you. The second recommended moisturizer is this one, Aquaphor. Aquaphor also comes in a large size with over 500 ml, so I highly recommend it. This is a moisturizer made for babies, so it's also highly recommended for people with very sensitive skin. It's marketed as a cream type, but it's actually more like an ointment than a cream. You can apply it thickly, so it has a very high moisturizing effect. However, if you use it on work days or in the morning, your skin can get quite sticky, so please be careful about that. And one last thing to be careful about is that if you apply cream-type ointments to red inflamed skin, it can cause stinging or irritation. So when it comes to red skin, basically, please use a steroid ointment. Steroids are basically, since moisturizers are also included, basically you should apply steroids to red skin. And once it gets better, use ointments or creams. Creams can cause stinging, so be careful when applying them to red areas. So how was it? This time, I gave a thorough explanation of atopic dermatitis. What were the 3 parts of the atopic cycle? What was the origin of atopy? Mention effective home remedies that don't require a hospital visit. I explained 2 allergy countermeasures and 3 ways to use steroids. I talked about important things, the amount, how to apply it, and how long to apply it. How did I explain each of those? What area does one fingertip unit cover? I also talked about proactive therapy, tacrolimus, and moisturizers. This is a treatment to prevent atopic dermatitis from getting worse when the skin condition has improved. Please make sure to remember this. And finally, the most important thing is that atopic dermatitis is a chronic disease. It will repeatedly get better and worse. I can't promise that you'll definitely get better just by watching this video. As your doctor, I must be honest. We can lengthen the stable periods of your condition and lessen its severity during flare-ups. Making those efforts is important, and you may find your atopic dermatitis didn't worsen all year. I think that's something you can aim for, so please watch this video as many times as you need, share it with your friends, and I hope it can help even a little bit those who are struggling with atopic dermatitis and whose quality of life has been affected. Lastly, in the comments section, I've explained the differences between ointments, creams, and lotions, as well as their recommended uses and characteristics, so please be sure to check out the comments section too. And if you have any thoughts or feedback, leaving a comment would really encourage me, so I would really appreciate it. Well then, thank you very much.